All right, so here is an overview of MI. I'm trying to summarize the salient points Dr. Austin talked about. The key is open-ended questions, reflective listening, elicit, provide, elicit, evoke, summary, and planning. So we need to ask permission. That's one of the aspects where we show respect to the patient. We ask the patient and elicit. We ask the patient what he or she already knows or would like to know. Where are we starting from? Then we provide a small amount of information. Then again elicit, ask questions to see how that information was interpreted. What do you think about it? Open-ended questions, as Dr. Austin pointed out, these are questions that cannot be answered with one word, yes or no. And it's also important for me when I'm dealing with my teenage daughters. So these questions are designed to elicit discussion between patient and provider. We invite the patients to share, ask to tell more. It's about how and why, as Dr. Austin pointed out. What I do a mental note of is for each closed-ended questions I ask, I use 4 open-ended questions. So one example is, what do you know about diabetes? I was wondering if you can tell me a little bit about your eating style. And then the challenging part for me was focusing on part of a problem. I wanted to give them everything I knew before. So now I need to focus on part of a problem, collaboratively set the agenda. Today we are going to talk about just the liquid drinks, soft drinks. So we have to focus on one item to discuss. Reflective listening. So here we are listening, understanding, amplify and reflects the patient's talk back. So these are statements, not questions. So here we can reflect the content as it is or the meaning of what a patient said or implied. Some of the examples are, it sounds to me that part of you really wants to lose weight. But you did have some success. We need to emphasize their interest in change. Tell me how you felt then. Tell me what changed. So this is also to give an opportunity for the patient or parent to reflect back. And then Dr. Austin talked about sustained talk. We need to identify specific instances of sustained talk, language that indicates this particular patient does not want to change behavior. For example, patient may say, eating really calms me. So in this scenario, how do we respond? By acknowledging what is being said and toward a stronger consideration of behavior change. It's great that you're figuring out eating really calms you now. Sounds like finding another way to calm you would be a great step forward for you. So here we are avoiding accusation and argumentation. And another aspect Dr. Austin talked about is change talk, language that indicates a change is being considered. For example, if the patient says, I know binge eating is bad for me, here we want to identify change talk, acknowledge, reflect on their own feelings, and maximize motivation. Eating behaviors are something you like to change. Sounds like you have a lot of reasons to do this. How would you go about making changes? So evocative is seeking persons on motivation. We discussed this multiple occasions. We are eliciting the patient's reasons for making the change. Then we help to facilitate and move towards the next step. Affirmations are important, as Dr. Austin pointed out. How were you successful when you lost weight before? And another important component that I'm trying to practice is readiness ruler. If you decide to follow a good diet, on a scale of 1 to 10, how likely are you going to make that change? If the patient says they are at 5, not 10, you can ask, what made you choose 5, not 10? What would it take you to get you from 5 to an 8? So as Dr. Austin pointed out, the most important final part is summarizing and closing the deal. What I hear you are telling me today is that you are ready to make some changes. You are thinking about some things that might work for you. You definitely want to change your eating so that you can feel better about it. Do I have that correct? Where would you like to go from here? Can I suggest you come back and see me in a couple of weeks to chat about this? So here we are transforming barriers into plans. And it is evidence-based. More than 300 clinical trials have been conducted. MI helps providers to effectively address and facilitate sustainable patient behavioral changes. It's used in accepted clinical guidelines. I want to finish my talk with this quote. If patient engagement were a drug, it would be the blockbuster drug of the century, and malpractice not to use it. Thank you.